Okay, this is wet to dry dressing for you guys to review. We have 3 sets of clean gloves here, about four by 4s with 2 packages each, with 2 4x4s in each package, your ABD, and then we got tape, we got biohazard bag, irrigation kit, have your sterile normal saline, a culture, Sharpie, chucks, and sterile gloves. Okay. We have already checked the doctor's orders, and we have previously came in and introduced ourselves to the patient and explained to the patient the procedure, what we're doing, and we have also assessed for pain. Now we have entered the room, and we are now starting to tear our tape for later. Come in, raise the patient's height of the bed to a comfortable working height, and put on clean gloves so that you don't soil your hands when some drainage comes out as you uncover the wound and remove the old dressing. Expose the patient only minimally if possible. Okay, then we put our chucks in there. Catch any drainage that might come out, keep the patient's bed clean, and then finally our red biohazard bag. Just hold it up like that so that it stays open. Okay, now we assess the outside of the wound and then start loosening the tape and try to remove all the dressings all at once. Assess cold cut and discard it in your bag, as well as your soiled gloves properly. Next, you will now prepare for cleaning around the wound prior to obtaining a culture. Okay, try to work from the distal end of your table to proximal. Okay, don't contaminate it. Although at this point this is still a clean procedure, we try to observe sterile technique over a clean procedure. Now we can open our irrigation kit, as well as our sterile saline, cap up. I can also pour liquid there straight from the bottle, and then go ahead and fill my irrigation bottle with saline. Either way will do, because if we use the syringe to moisten your gauze, you notice that when you guys checked off, you end up pressure washing the gauze and it comes out of its sterile package. So don sterile gloves. Then grab one of these moistened 4x4s to clean around the wound. Parachute it, take care not to touch the surface that will actually be touching the patient. Wipe from top to bottom, discard, grab another one. Again, the same way, parachuting it, touching only the corners, wipe from top to bottom, and then grab one of the dry ones. I could save one for later or after drying the skin around the wound after irrigation. Now I can discard gloves, obtain my culture tube, open it, uncover the culture tube, handle this well, and just swab it around the wound, in the wound bed, so you get all the organisms that's in there, and then carefully put it back in your culture tube. Now you can sign and date it, identify what culture it is, and set it for lab later. Okay, now I'm ready to irrigate. Another pair of clean gloves. You okay there, Mr. Jones? Alright, now we can start irrigating. I use this, as well as get some sterile saline. Remember to keep the barrel, the syringe, sterile. Use this to catch any drainage. Again, irrigate from top to bottom. After which I say this, keep it sterile, my last gauze to dry around the wound. After which I discard everything. By now there should be a lot of drainage everywhere, so I will get rid of this as carefully as I can and put it in my red bag. And discard these dirty gloves. Get rid of these in the trash. Now I'm ready to do and prepare for my sterile procedure of packing the wound. Okay, remember that we're only moistening the 4x4s. It doesn't have to be soaking wet so that it will do its job of actually absorbing any drainage inside the wound. Again, working from distal to proximal so you don't cross-contaminate or cross your sterile field. Okay, now I can moisten one of them for packing. Pour from the side. Okay, that should be enough. Now since everything's ready, now I can put on sterile gloves, because now I can safely touch sterile equipment only. Again, just say hi to your patient every now and then. You doing okay there? Okay, now we can don sterile gloves. Then sterile touches only sterile. So I can only handle the outside of the glove. Then glove the other hand. Again, you don't need to fix these or risk contamination. That's fine. I'm only working with my palms and fingertips anyway. So grab just enough gauze to fill the wound. If you need two, then use two. In this case, I think only one should be able to pack the wound. Okay, pretty much covered the wound now with this one. Okay, if anything hangs out, don't bother putting it back into the wound, or else you'll contaminate it. Two 4x4s, or however many you need to cover the moist dressing. And then finally, remember ABD, the blue line indicates that it's the outside. This side without the blue line is the absorbent side. Cover your wound. And then finally, get your tape. Securing all four sides of the dressing. Safely remove dirty gloves, and you can sign and date your work of art. And get rid of your clean up after yourself. Put these in the trash. Wash your hands.